Welcome to A Journey to Whole Woman Health, the podcast where science, mental health, and faith come together to educate, empower, and encourage women in every season of life. We are your hosts, Dr. Jamie Erwin, board-certified OBGYN,
and Dr. Mary Kathryn Nader, licensed professional counselor with a PhD in counselor education and supervision. Jamie and I have been friends for over 30 years.
Each week, we explore the intersection of body, mind, and soul, bringing you evidence-based medicine, meaningful conversations about mental health, and stories that remind us we're not alone on the journey.
So take a deep breath, settle in, and let's begin the journey. Hi, and welcome back to the podcast. We are so excited to have our guest with us today, Dr. Erin Eastman, who also happens to be my cousin. And I'm just so honored that you made time to be with us. We're so excited you're here. She is a board-certified pediatrician and pediatric hospitalist in Denver, Colorado. She earned her medical degree from the University of Texas Health Science Center at San Antonio, completed her pediatric residency at UT Southwestern Medical Center before moving to Colorado to care for children and families. She's always been passionate about pediatric and newborn medicine. I remember you saying as a child that you wanted to be a pediatrician. Erin has always loved kids. And also, fun fact, both Erin and Jamie were bridesmaids in my wedding. I was thinking about that.
Fun.
And I remember walking with y'all both through med school and being like, ooh, what if they both end up doing, and then y'all chose different pathways. And so it's just so special to get to have this time together. Thank you for making time to be with us, Erin. We love having you.
Thanks so much for having me. I have been listening to this podcast and I love it. Multiple times you guys are referencing, so you can listen to this while you're on your run or on your walk. And I'm like, yep, I'm doing that.
Yeah, right now. Erin's also a runner. You've always been a runner. I remember.
Yeah, I think my mom wishes I wasn't a runner when I was like 9 and 10 months old. I was
We
a
got
little
a
bit of
runner.
an escape
I
artist.
remember times being like, Erin, come back. We're going to get in trouble.
Yeah. This is like, we can do a whole podcast on Mary Kathryn trying to keep Erin out of trouble. But yes, I was a very hyper wild kid. So mamas, if you're listening and you have a wild one, it's okay.
You're going to make it.
You're going to make it.
Okay.
Put them in sports. They're going to be fine.
Yeah. Let them run in soccer.
Yes.
Field hockey. Give it a go.
Yes.
Yeah.
Erin, we are just so delighted to sit down with you and talk. We want to hear about your story. We know our listeners are high-achieving women. They're working women, whether it's outside the home or within the home. Some are mothers, some are not. Some are hoping to become mothers. Some are empty nesters. Some are grandmothers. So we really have such a wide audience. But what is the message you would like to share in regards to your story? What do you want our listeners to know and be encouraged by your story today?
Oh, that's such a good question. I think just the freedom to know that whether you're a Christian or not, your path is going to unfold different than you expect. And as a Christian, I would say, God gave me exactly the right timing in ways that I wasn't sort of prepared for, and his timing was wonderful with lots of different things in my life. So from a young age, just trying to achieve each milestone at the right time. I wish I could go back and tell myself to just slow down. It will all happen the way he's intended it to. And as things happen that you may not have wished, they happen in that order, in that way. So I would just say he is faithful to bring to fruition things in your life that maybe you wouldn't have had them go in that way.
Yeah.
So.
Yeah.
That's great.
He's in control, and he knows his ways are higher than our ways. So
Absolutely.
often we don't know what he's working on, but he's always working.
Yeah. So do you want to share any of your story?
Sure. Where do you guys want me to start?
Have you always
I
been
love
high
talking
achieving?
about myself.
Yes.
No.
Yes,
no.
you have.
I was, if you ask my parents' small group in Dallas, I was wild and hyper. I was kind of I think looking back, I may have had some ADHD that was undiagnosed, but I was a pretty hyper kid and a little bit impulsive. So again, just to encourage mothers who have slightly more impulsive or hyper kids, I think I just had a lot of energy as a kid. So I did get in trouble some with that impulsivity. And then as I kind of found a little bit more academic success as developmentally that worked its way out. And honestly, my parents putting me in a lot of sports helped with that.
Yeah.
But yeah, no, I think I had a great time in high school. Was, academically successful enough to get to go to Vanderbilt, which was a fantastic experience. And then, I felt like just to encourage women who are in stages of high school and college, we hope that you guys have some younger listeners. I found my people the further along in training I went. So I had good friends in high school. I had great friends in college. And as each stage, I joke with the medical students that we have. There is a term that we use in medicine for cells that haven't chosen what kind of cell they're going to be. And that means that they're pluripotent. This is the nerdiest joke ever. I don't think this is going to relate to your demographic. But I ask the medical students, are you still pluripotent or have you differentiated yet? So if you're a female med student, you're going to get this joke everywhere. Anybody else is not going to. Yep. But I felt like I was sort of undifferentiated. And as I found my path, Jamie's laughing.
I love it. I'm just giggling over here. It's so cute.
I felt like it was just school got more and more fun as I went along. Mm-hmm. So I think that's a part of my story is just I really, really loved school. I loved med school. I had such a blast learning. And then when I got to residency, I'll tell people it felt like, someone told you what's your favorite flavor of ice cream and you say, I don't know, strawberry or butter pecan. And they're like, yeah, you need to eat 5 gallons of that in the next 24 hours. And that's a little bit the way residency felt, but it was really, really fun. It was hard work. There were, there's a lot of sleep deprivation, but I think honestly that impulsivity, hyperactivity I had was kind of helpful because I didn't need as much sleep. And so, yeah, that as far as my academic trajectory, I had a lot of success and it was really fun. And I think I had more success because it was fun. But I do think, as my friends as we were all sort of getting older, I did struggle with not finding somebody to marry right away. And I think, a lot of women who go down the professional pathway could maybe relate to that. I think the longer you wait to get married, you start to really understand where your standards are. And that can be hard because your standards are pretty high as you get to know yourself better. And you start to realize, gosh, there's a really small number of people that I could end up with. So that is a part of my story. And that's something I love to encourage young women in their professional years with. And I remember Mary Kathryn and we talked about that a lot when I was younger. I think Mary Kathryn has a funny thing that she says where she's like, it's better to be single than divorced. And she was right to encourage me to continue to be patient on the Lord. So,
well, and as a doctor in training, you're not going anywhere.
No.
You have no life except
totally.
in the hospital.
Yes.
I mean, Mary Kathryn and I have been friends since freshman year of high school. But there was a big gap where she didn't hear from me and my family didn't hear from me and friends that I had before didn't hear from me. And it's like you just kind of drop off a cliff for a few years. And it's not like you have a lot of opportunities to go out and meet potential partners, potential husbands. So what did that look like and how did you navigate it?
So, well, first I'd say I had God really blessed me with a fantastic group of friends at each stage. We had so much fun in med school. We had so much fun in residency. My residency girlfriends and I are planning a get together in Breckenridge this summer, and it's been years. And I know we're going to pick up there's been no lost time.
We have a reunion. We try to do a reunion every year with my residency.
It's so buddies. Fun. We would use the term trauma bonded, which feels a little flippant because there are people who've undergone much greater degrees of trauma than just an 80-hour work week. But it's true. You go through some hard things. You see really bad things happen to children, and then you kind of are locked in during that stage of life. So I had great friends. I had a great church. And then Chris and I met. We were just ships passing in the night. He was a consultant for a firm in Dallas. He was working crazy hours. I was working crazy hours. And so we would see each other maybe once a month at church. And through some mutual friends who said, hey, Chris, you should ask Erin out. We started dating. And so we met, and he would, we didn't see each other much because I was working so much. So he remembers coming to the call room and bringing pizza, and he'll make the joke, well, this isn't at all like Grey's Anatomy. That Grey's Anatomy was really big at the time. It was all women with no makeup on, sleep deprived,
yes,
griping about work or something or other. So he was really faithful in that, and he stuck around in spite of the crazy hours and was patient with me. So that was, had I met somebody, I think before residency, I either would not have had time for them because I was just so enraptured with school, or I potentially could have just quit. I think about it all the time that had I met somebody in college or, too soon and gotten married, the way I felt after I had my first baby, I can't imagine feeling that way and getting up and going to work for 30 hours. It was that I don't, my motherhood and, love affair with pediatrics would not have been compatible earlier in my career. So, that's the way I think God intended it to be. He gave me my first child, which was pediatrics. And then, Chris and I were able to find each other and get married and start our family. And so I didn't have Katie until I was out of residency. And that was so healthy for me because I was able to drop down a little bit in my work commitment and adjust to being a mom a little bit.
Tell us about that. What was that like for you to go from, focusing so much time and energy on career to motherhood and trying to balance that?
Oh my gosh, y'all, it's so hard.
Yes.
I tried to talk about this with my family. Being a doctor is challenging, but of course it's hard work, and I don't want to belittle my work at all. But trying to find someone and hire someone who could do things exactly the way I wanted them done for Katie in the beginning was harder. Finding childcare and finding the replacement for every small task that I kind of wanted done in a certain way. Not that I'm a control freak at all, but that was hard. It was really hard. I felt, at the time I hadn't done as much research on breastfeeding and oxytocin and bonding, but I felt like a palpable cord, like a rubber band being stretched every time I was away from her. So we found a really great daycare down the street from the clinic that I was in Dallas. I was at Los Barrios Unidos, which was a great underserved clinic.
Because fun fact, Erin's also bilingual.
I am bilingual, kind of. I don't know. There are scenarios I get in and I'm like, oh, that Spanish is not quite to my, that's above my grade. But no, so I would try to go to breastfeed her over my lunch break, and it was an emotional couple of years. It was a year. Katie was a year old when Chris found a job in Denver. We moved to Denver, and I was pregnant with my second, which was so much fun to have two little girls so close together. But the first job I got with Kaiser when we moved to Denver was going to be a part-time temporary role, and I was working these 4-hour swing shifts, and I would leave Chris with Lizzie, who was 8 weeks old, I think, at the time, and Katie,
she was a hard baby.
Yes. So that's something we should talk about. So as a pediatrician, I had this beautiful, perfect baby, and she was a fairly easy little newborn, but then she had colic. And so that was an interesting journey for us, and it made childcare even harder. Chris and I had a number of funny conversations where he was like, I don't think this is normal. And I said, no, this is colic. This is developmentally appropriate. We're going to write it out. We're going to do the 5 S's. And for those of you who need some advice on colic, oh my goodness, it is so hard.
What are the 5 S's?
Know that you are loved. Don't buy this book. This is not an endorsement for Harvey Karp's book. This pediatrician's made lots of money off this book. But the 5 S's are swaddling first, shushing and swinging are second. So basically everything you can picture your grandmother doing. Moving. And then so swaddle, swing, shush, and then stomach or side lying. and then sucking. So when we were in the middle of the throes of colic, I would do all 5 at once. I was like, she was swaddled, she's like latched on my breast, and we're bouncing and we're shushing, and that worked. But Chris, there was one of those options that Chris didn't have. So these swing shifts, I would leave Chris with Lizzie, and he would have this, a little bit of look of desperation. And so we actually hired some help during that season. A really nice woman from our church came and would just help Chris with Lizzie and just hold her and shush her and rock her. And it was so helpful.
Because your firstborn Katie
read the textbook. And so Katie followed all the rules.
She tricked you into having another one.
We had the perfect golden hour where she breastfed for 40 minutes and she looked at me like, I'm going to do all the things right. And then she did. And then she settled into a Q3-hour feeding pattern every 3 hours. And then she didn't cluster feed until 24 hours of age, and all these, terms we can get into later on. But she fed frequently, in the time period she was supposed to. And then we went home and she just was like a regular baby. And I was like, this is what I've read about. I'm going to be great at this. And then the Lord gave me a secondborn who my labor was really short. Everybody loves to tell their labor story. I don't need to tell my labor story here, but it was a short labor. We got to the hospital, had a baby. And then Lizzie did not give me a break. She started cluster feeding at like 5-6 hours.
Wow.
Which has actually given me so much compassion with my, second time around moms with a short labor, third time around, fourth time around moms, just given me a little bit more insight into ability to prepare somebody for, it seems like if you have shorter labor, that second stage of labor, if you really only push a couple of times, that window of time that the baby needs to rest and recover seems shorter. Some babies,
you're like, I'm ready to go. Let's eat.
There is a not small number of babies that are like really ready to go at 6 to 7 hours. Yes, it's so wild.
Okay, that helps me. I'll encourage my patients. Just be ready.
So
cluster feeding.
Slow your labor down if you want the rest.
As if they can, right?
Right. But, as if we could control that. Yeah. So Lizzie was a little harder, and then had a little bit of colic. But she was also a more attached baby, which was so good for my mom heart. So she was easier in some ways and just different. Just a good reminder that every baby's different. And
and we're not failing if our baby acts one way or the other. Like the baby's going to be different. You don't have control over all these things.
And I don't know who needs to hear this, but even as a pediatrician, I introduced formula pretty early.
Yeah.
I was able to breastfeed both babies past a year, but that doesn't mean I didn't start formula by 4 months, 3 months, something. Both girls, it was within a time window of, it was just time.
It was needed.
Yeah.
So tell us what is the advice now that you give to new moms? What are some of those pieces of advice?
So kind of referencing those first 24 and 48 hours, when I was having Katie, when I was laboring with Katie and I was pregnant, kind of getting ready for the delivery, Mary Kathryn was actually the first voice of wisdom who that I had in my life. And she asked me a couple of just really healthy, important questions. And I think one of them was along the lines of, what kind of help do you want? And I was like, well, I don't know. Like, what kind of help do people get?
What are my options? Where's the menu, Mary Kathryn? Do you have a menu I can order off of?
And, this was like kind of pre-Brene Brown, pre-Clear as Kind. Like, I don't remember hearing anything like this. And the way that she helped me kind of basically talk about what kind of help I thought I might need has really influenced the way I talk to moms now. So a lot of times with a first-time family, they're really on the ball and they've already thought about these questions. But if they haven't, I'll usually say, hey, have you guys thought about what you are going to want and need in the next couple of weeks? And sometimes they say, oh yeah, my sister did this and my brother did this. We're the babies of the family and this is how it's going to go down. Wonderful. But if you haven't, some of the things that I think are helpful is to make a list. So I'll usually make a joke, whoever's bossier of the two of you, or if you have a bossy cousin or sister or best friend, someone needs to have a list of what you wish somebody would offer to do for you. You can phrase it however you like, but when people start texting you, especially for women in their late 20s and early 30s, your overwhelming response is going to be like, I got it. I'll let you know. I got it. And that is a muscle that is, I think, a little bit hypertrophied that we need to kind of undo and relax a little, because what we want in that time period is for you to accept and receive help. So I'll encourage families to make a list of 5 to 10 things that you wish somebody would say. And then when someone does send that text message, send the list out and say, hey, here's a list of things that we thought would be helpful. And if one of these speaks to your love language, then choose one and feel free to help us out. And if not, then let's get coffee in a couple weeks, because I'm going to need to get out of the house. And what I found, and this might be an overgeneralization, but there are generally at least 2 types of people in your sphere of influence after you have a baby. And there's a small group of people, they want that list so bad.
Yeah.
They want nothing more than, and it's usually the 2s. I don't know if we're going to talk about Enneagram at some point, but I am a strong 2 with a 3 wing. There are a bunch of 2s out there that are like, give me the list.
Yes.
I want the list. I want to do it just right. And they just want to do the thing. Just tell me you don't like mushrooms. Tell me that it's a festivities poppy seed chicken. I'll go get the thing.
Yes.
Most of us have at least one woman in our corner like that.
Yeah.
And they want the list, and they're going to love you for it. But there's another group of people who I call them the lasagna makers. And they're no shade to the lasagna makers, because they keep the world running, because they'll make 20 lasagnas and get it to everybody. But they're going to make a lasagna if you don't tell them what to do. And they don't care. They do care, but they may not recognize that you're gluten-free and meat-free and dairy-free. But they make lasagna really well. And those people need some guidelines, because they're not going to recognize that that's not the way to serve you unless you give them a list and some boundaries. So
don't you think we've been brought up, though, that if we, I have to battle this.
Yes.
So I have to battle this. But I think there's a mentality and a thought that you're presumptuous if you are vocal of like, I need this. Like somehow we are imposing, even if they ask, but like, am I asking too much? I have to battle that in myself. Like, I know you asked me how you can help me, but I feel like I'm not enough if I'm asking for help. Mary Kathryn, help me out with this. What does that mean?
This is who this advice is for. So
yes.
I think most women feel that way.
Yes.
And as another woman who is going to, respond to these different requests, I think the least intrusive way to share that is to wait till someone offers to help, and then say, here are some things that you can choose to do if they speak to your love language. And again, that's my language, but not everybody's going to share it in that way.
What are some ideas? If someone's listening to this is like, I don't even know what to put on that list, what would you put?
Meals. So first of all, I actually go through and spend 10 minutes with families. Think about whether you want people in your home or not. Think about whether you want food or not. It's okay to not want food. Food preparation may be your thing, and you may not want people making food for you, but this is an important psychological exercise to decide what is a task you don't like doing around your house. Some people have family members who want to get in their home and scrub their toilets for them. That would feel intrusive to some families, and it would feel like, oh, praise the Lord. I just hate toilets. So it's talking through, what are you comfortable with? And then oftentimes I'll encourage families, the husband and wife need to talk about that, because there's nothing more sexy in the immediate postpartum period than having a little spat with your husband and then hearing him say, we're going to do it this way, when you really had to talk about that. And he's kind of, sacrificed something, or just knowing that you're going out into the world together can be really empowering and really good for your family unit as you kind of decide how you're going to do things. So I would talk about, and when I offer to do things for families, I'll say, do you want a meal, Monday or Thursday, I can do a meal. Do you want me to do a Target pickup run? Or do you want this? And so I'll offer an acts of service thing, a food thing, or do you want me to stay? That's another thing, is decide, I wanted people to stay when I had people drop off meals, because I was kind of lonely in Denver when we first moved there. I had Lizzie 5 months after we moved. And I still vividly remember a woman from our church staying and just helping. And she had just had a baby 6 months earlier, and she brought her meal not cooked yet and was like, hey, preset your oven to 400. I'm going to pop it in when I get there. And I loved it so much. But knowing ahead of time,
you wanted that companionship.
Yeah. And then just kind of including, we want people to stay or we don't. Are some things to know about yourself.
Yeah.
And then it's okay to pivot. It's okay to change your mind after you've been home for a week and say, wait a minute, I don't think I want people in my home. I think communicating that ahead of time to families is so helpful. It is so much easier to tell out-of-town families. In Denver, there's a lot of transplants. It's so much more helpful to negotiate ahead of time. Do we want people staying here or not? That just can solve a lot, of problems and promote just health in your kind of extended family when expectations are clear. Again, Brene Brown, clear as kind, But yeah, Mary Kathryn was the original person who shared the idea of that list with me. And I have found it so helpful in my own life. And then just telling families, like, this is a big change. Learn how to receive help and make a list. Anything else you would add?
I think all those are great. I mean, I just think through your daily list of things. Like, do you need somebody that just to come walk your dog for you? So the dog's not hyperactive and driving you crazy when you're trying to nurse a baby, or do you want somebody to, again, how much do you want them to be in your stuff? But like, I know friends that will just like pick up laundry, like leave it on the front porch. I'm just going to come pick it up and do your laundry and bring it back.
Amazing.
I mean, there could be all kinds of things, any sort of daily life, or just pay to have your house cleaned, to pay a maid.
Yes, we have done that in Denver. We've done that for certain friends who it's just like, oh, it's such a godsend.
It's such a thing. Or come mow your yard or whatever it might be.
Totally.
Like, there's just so many activities.
And nobody can read your mind.
No one can read your mind.
We have to remind ourselves that way. And the fact that your partner especially can't read your mind doesn't mean that they love you less.
Right.
You have to just tell them exactly what you need.
And family members too. It's not like they should just know. I think we have this thought of like, it's only meaningful if they just know. It's not.
Right.
Like, giving them the specifics is great, because then they can choose how and if they want to help, how they're able to help.
And I don't know.
It's like making a registry list.
Yes.
And people buy you a gift off of it. It doesn't mean that they didn't think of it. Actually, a lot of times when people make a registry, they're annoyed when they get something not on the list, know? So like, being specific about how people can be helpful for you. Is helpful.
When we moved to Denver, I had Katie already, obviously, was pregnant with Lizzie. And I remember feeling like I had this beautiful nest in Dallas and my family was close by. I had just this network I didn't even realize I was going to miss, of not just my work colleagues, but people I knew in the hospital who knew me. Reputationally, I felt just secure in the type of human I was, living to be in Dallas. And we moved to Denver, joined this church that has just been a godsend for us. I made a couple of friends, and it felt like I had like 2 pieces of straw under me, and the egg was coming. And I literally had a couple of dreams where, as a bird, my little bird wings were like catching the egg, and it was so stressful. And I remember feeling like there just is it's going to take forever to make community.
Where's my nest?
And I do think, as I've gotten older, I view if we have sort of a looser nest, there's always a space to put in another straw and put in another feather, and to just allow others into our lives. And so it's part of what I try to communicate to first-time moms is, make space for people to be integrated into your life, because you're going to need them. And especially working moms, you're going to need it when your child is 2 and they have a fever and you're in the OR and your husband's out of town and your nanny called in. I mean, it's just, and that we really found that to be true during COVID. We relied so deeply on our network. I can remember calling, our church is Wellspring in Inglewood in Denver. And I can remember our youth pastor calling. This is brilliant. The pastors divided up and just had a list of congregants they were going to call and just check in, what do you need?
Wow.
And I sobbed on the phone with our youth pastor, Sarah, and she said, what do you need? And I said, childcare, because our nanny had quit because of her husband was a little older and at risk for COVID, and due to the nature of my job, it was stressful. And I just sobbed. I was like, I don't know how I'm gonna make it work. I have no one to be with my girls. And she said, hold on, we have a whole network of like 20 somethings who are stuck home from work. Can I just give you some names?
Beautiful.
And I just sobbed. I was so thankful for the help.
But you put yourself out there too. You were vulnerable and said, I need this.
It was just this healthy exchange. She called and asked what she could do.
And you were honest.
And I was honest. And that is the beauty of community. And that's how it's supposed to work.
That's right.
And you mentioned first time moms. I think a lot of times we have this misconception with our second or third that it's going to be easier. But I've seen a lot of times it's actually harder.
Yeah.
Totally.
Because now I've got one that I'm trying to entertain and take care of. And I think a lot of times communities think, oh, you've done this before.
Totally.
You don't need as much help. But actually they might need someone to come pick up the toddler and take him to the park. Or they might need somebody to come hold the baby so that they can hang out with the toddler because they haven't really gotten a chance to do that. So even if it's a second or third or more pregnancy, that mom, that family still needs that support.
Because you don't get to go just take a nap when the baby's sleeping because you've got the toddler.
You've gone to man on man. Before it was like, okay, you've got the baby, I'm going to go do this. Or when you've got two, it's like, you've got this one, I've got that one. Nobody gets a break and it's exhausting.
Well, and just if I could affirm the mothers out there with there's something unique. If your oldest is under the age of, I'd say 4, didn't really get a little bit easier until 4, then it doesn't matter if you have 1 or 2 or 3 or 5. It is really hard to bring a baby home.
Yes.
And try not to compare yourself. I hear a lot of women who have just 2 talk about, oh gosh, I could never have 6. Oh gosh, I could never have 8. Not to diminish the workload of women who have more babies, but I do think the transition from 1 to 2 or 2 to 3 is one of the hardest.
Yes.
Because if you are having more children, you usually have a helper. You have at least one who can go grab the diapers, who can find the show that the 2-year-old likes.
Right. Yeah.
So don't be so hard on yourself and think about, that 1 to 2 and 2 to 3 shift is really hard.
It's difficult.
And you should absolutely be reaching out to your community, and people want to help.
That's
the other thing I tell moms all the time. The people that love you want to help so bad they could just cry. I mean, it's just think about it this way too. There are Enneagram 2s like me out there who are constipated with help. And it is so affirming to who they are to provide the help. It's like an exhale of oh, I'm so glad you told me how to help. You're relieving stress for them.
You have to get it out of you.
Unpack. You're they need to help. They're going to go crazy.
Oh my gosh.
That's their own issue.
Yes.
But really,
it's a gift for them. They enjoy it.
It is a gift for people to help, and it's good for them, just like it's good for you. So when you don't share what you need, it's depriving people of a deeper, meaningful relationship with you.
Yes, that's so true. That's
beautiful.
Beautiful. That's a good place to end it on.
I think so.
Yeah.
I want to wrap up and share, is there a time in motherhood you felt like you lost yourself? And if so, how did you find yourself again? I know running's been a big part of your life, but share with us that.
I can't say that I've lost myself. I think for sure there have been things that have been disappointing. And I think one of the more protective things, as I've gone through periods of disappointment in my life, has been running and establishing a friend group that is outside of motherhood. I am an extrovert, and I'm only more affirmed in my extrovertness the older I get. But I absolutely thrive on relationships with lots of different people. And the running community has been really fun and freeing. And as I've gotten older and when we moved to Colorado, I've done more trail running, and there's really, there's no pace that you can set yourself to because the hills are there and
the rocks are there.
You're going down and you're going to hike some. And so, trail running has been fantastic. And the friends I've made through just sports, being outside, hiking, running, skiing, have been just really fun women who keep me grounded and keep me laughing and keep me humble. And it's just been a really fun community to be a part of. Yeah. I definitely feel like the Lord is there. I feel like he meets me in the mountains, and there's a lot of scripture that talks about, looking to the mountains. And I feel like that's a place where, we could talk more about the mental health benefits of running, but the rhythmicity of your feet. We talk about this in our friend group sometimes, that there may be some subtle, overlap with EMDR when you talk about difficult things in your life and you're going through movements that are rhythmic, there's something that you are able to process in a different way that I think God made us that way. God made us to move in a way that's
that bilateral stimulation.
Yeah, absolutely. So you'll have to tell us more about that. Yeah. It's like fascinating to me.
Well, I think that's so fitting because today that we're recording this is actually Global Running Day.
Oh, I didn't know that. That's
I didn't know that either.
It's
That's
true.
awesome.
I'm running a 5K tonight, so you should come do it with me. You have plans.
I could. I would be slow as molasses. I am like so not in sprinting shape, but.
And summer is here. It is so
hot. So hot. Welcome to Texas.
Yeah.
Ugh.
Yeah.
Yeah.
Well, this has been delightful. Fun. Thank you for being vulnerable, for sharing your story, for sharing your wisdom to expectant moms, new moms, experienced moms. I've learned some things, and we hope you will send this right away to that person that popped into your mind that you know needs to hear this from Dr. Eastman. We're so glad you're here on the journey with us through whatever season you're in, and we know you'll want to come back next week. Thanks for joining the journey.
Thank you for joining us on a journey to whole women health. If this episode encouraged you, share it with a friend, leave a review, or subscribe so you don't miss future conversations. Remember, your questions matter, your health matters, and wholeness is a journey. Until next time.
Now for the legal language. The information shared in this podcast is for educational purposes only and is not intended as medical or mental health advice. Listening to this podcast does not establish a doctor-patient or therapist-client relationship. Always consult your own qualified healthcare provider regarding any medical concerns.